We're going to be placing an implant in position number 10. The tooth has been endodontically treated and an abscess has developed on the facial aspect, making the prognosis for the tooth highly questionable considering the minimal amount of tooth structure remaining. When we see the clinical photo on the facial aspect of number 10, we will see a small red fistula, and this is the area of concern. This tooth will be removed using a series of luxators. These luxators are very easy to use, and they allow us to apply a vertical pressure on the tooth to be removed, thereby placing the least amount of trauma that we can while removing the tooth. You will notice that as the luxators are used, the tooth will begin to give or to be noticeably loosened or moving. We use these instruments primarily mesial-distally, although occasionally we will use them on the palatal aspect, but we do avoid the facial aspect whenever possible. We will see that the tooth in question is moving as we luxate the tooth, and in just a moment we'll see that the tooth will actually become displaced or fall out of the patient's mouth. Here we see the tooth is totally luxated, and the tooth has been removed, exposing a very, very nice extraction socket. We use a curette to thoroughly debride the socket, and then we use a periodontal probe to assess the facial aspect to evaluate the buccal plate. We use a surgical precision drill to start our osteotomy, followed by the series of appropriate drills for placement of the 4.0 NEOS dental implant. We will prepare the site using the surgical drills as we mentioned, and then once the implant is in place, we use a hand or torque wrench to make sure that the implant is very stable. Once the stability has been achieved, we will then place a small peg into the implant to allow us to measure or take resonance frequency analysis, which is measured in International Stability Quotient. We take 4 measurements, mesial, distal, palatal, and lingual, and in this case all of the measurements were equal to or greater than 60 ISQ. In some areas I believe it was higher than 60, close approaching 70. Once these measurements have been ascertained, then we put a custom NEOS healing abutment or a customizable NEOS healing abutment on the implant. This will allow us to create the proper emergence profile during the healing process. It's a very easy, simple method to implement, and really enables the restorative dentist to take a final impression at the second stage. We see a 1-week healing result. The healing has been very, very nice, and we will follow this patient over the months ahead until we do the final restoration. Again, notice the beautiful healing at the 8-week healing interval.